Good morning, everyone. I see your lovely faces. Hello, hello. Start momentarily.
Good morning.
Hello.
Morning again, everyone. Thanks for joining. Just waiting to get all our panelists on board. Our county executive is going to be joining us in a few moments as well. And we are live on the county executive's YouTube page as well. So broadcasting on that.
Good morning, everyone.
Good morning.
Good morning.
Good morning.
Good morning.
Thanks for joining us, county executive.
Oh, well, thank you for having me.
Of course, of course.
It's going to be a great discussion.
Yes, we are excited. I believe there is one more panelist that I wanted to have join, but for the sake of time, we will get going so we can have your remarks. Hi, Dr. Askew.
Hello. How are you, Dr. Burt?
Carrie Ann, do you feel, if you feel there's a need for us to wait another moment?
Okay.
For your other panelists.
All right, just one more person. I'm trying to figure out where she is.
Okay.
Yeah.
Also gives folks on. I think we're streaming as well.
Yes, we are. We're on the county executive's YouTube.
Fantastic.
Yes. Oh, here she is. All right. Great. Okay. So let me get to record. Hi. Awesome. Okay. So good morning, everybody. Thank you for joining us for our second and last webinar in the Behavioral Health COVID-19 back to school fiasco that is going on for all of us. This morning's panel is going to be a series of presentations from our federally qualified health centers, representatives from those health centers. And we have some remarks that we'd like to kick off our morning with from our county executive, Ms. Angela Also Brooks, as well as Dr. George Askew, who is my supervisor, and is Dr. Carrie Ann Peart, and the senior advisor for the Health, Human Services, and Education portfolio, a mouthful, for the county executive. So, County Executive, I'll turn it over to you for remarks.
All right, good morning, everyone. I want to thank all of you, first of all, for joining us for this latest installment of our mental health webinar series, Behavioral Health, Back to School, and COVID-19. I want to begin by first taking a moment to thank Dr. Askew and his team for putting together this series. As you know, this series helps all of us, Prince Georgians, by elevating our knowledge and our access to behavioral health resources and services. I want to also thank our esteemed panelists for being here today to share their expertise. We have with us Dr. Brenda Carter-King of Mary Center. I want to thank Dr. King, Dr. Amar Mukhtar of Greater Baden Medical Services, Dr. Jose Segura of La Clínica del Pueblo, Robin Spearer of Community Clinic, Inc., and Alex Kelly of Family Medical and Counseling Service, Inc. This has been quite a year of new experiences for all of us, most especially for our children who are really experiencing a period of tremendous change. In a typical year, we know that our children would wake up early, they pack their backpacks, they head off to the bus stop while teachers make their way back to the classrooms and parents head out for work, but we know not so much this year. This year, all of our kids started off at home, sitting at a computer instead of being surrounded by their classmates. So this has been a stressful year for our children, and the way that our children have interacted with their peers and teachers has changed, so that during this pandemic, everything must happen at a distance. And parents are dealing with this. This has caused quite an amount of stress and change even for parents. Many parents, I have to tell you, including myself, are having to adapt to distance learning. I was saying just yesterday to someone, they said, well, how's it going in managing the pandemic? And I told them I have been successful in managing the pandemic. I'm not doing so great at going back to high school. So far as it turns out for me, my daughter is a 10th grader. 10th grade has been hard on me, I have to tell you. And so the majority of the stress I have experienced has nothing to do with my job and dealing with the pandemic. It has been my difficulty in adjusting to 10th grade. And that's just the way it is for so many parents who are, along with their children, adjusting. This has been an unfamiliar start to all of us. And so as we discuss these changes today, I would like for you to keep this in mind. You have behind you a tremendous amount of support from your county government, because Prince George's County cares about the welfare of our residents. And at the county level, we're doing everything we can to support parents, whether it's managing behavioral stressors at home or directing Prince George's parents to the resources they need to provide a stellar education for their kids during this pandemic. And so we look at how our school system is helping to support families during these times, and we'll notice that Dr. Monica Golson, I hope you agree with me, is doing a phenomenal job. I'm confident that Dr. Golson, along with all of our administrators and teachers and our board, they're all doing everything they can to protect our children, their parents, their teachers and staff from COVID-19, while at the same time making sure that no one falls behind on their education. Dr. Golson implemented distance learning for the first 2 quarters of the school year. I think this was very wise. We did so with the support of public health experts, families, employees, community members, and I agreed as well that this was absolutely the best approach for our community. But to ensure that distance learning does not leave any student behind, Dr. Golson and Prince George's County Public Schools enhanced their distance learning capabilities by adding new software and more live instruction. Of course, new technology can also present, as we know, challenges, which is why Dr. Golson has established parent support centers to assist families with tech support. In addition, student meals have been available and they're free for all of our students through December 31st. This has been very important for us. And most schools are serving at meal distribution sites. Some communities have drop-off locations, and then we have buses that are driving in as well to serve as community distribution centers. So again, I want to commend Dr. Golson and all of the other educational professionals in our county who have truly risen to the occasion during this most unprecedented challenge we are facing in our county. But we're also doing our part here on the county level. We've launched this month's mental health webinar series for the fall to help provide students, teachers, and families with mental health resources that they may need during this critical time. We've assured also, even before this, I was very concerned about the opportunity gap growing for our kids. We know this is real for our communities, is that we have long been concerned about the opportunity gap that would grow. And so we, during this summer, we made sure that summer learning programs were available virtually. We work with our library system also to put a number of student resources online over the spring and summer. And these are still available during the fall to assist students with school, SAT and ACT prep, and so much more. And so we'll continue to come up with new and innovative ideas to keep moving forward, ensuring that we have the resources that will be necessary for all of our students in the coming months. So if we take a step back, it is obvious that these challenges are affecting us, but let me just tell you something. There's nothing like a Prince Georgian. We are a completely resilient community. I'm so proud of how all of us have come together to take care of each other, to support each other during this time. And I said it at the beginning of this crisis, and I will say it once again, COVID-19 will not have the final say. We will. And I am truly just so confident and optimistic that as a community, we are going to not only make it through this crisis, we're going to come out of it stronger and better than ever before, and we will do so with the support of all of you. So I want to thank you, everybody, for doing your part during this crisis. Keep on keeping on. And I want to thank the team again that put together this amazing webinar series today. Thank all of our panelists. May God bless all of you, and may God continue to bless our county. Thank you so much.
Thank you kindly, County Executive. Appreciate you being here and your remarks. Thank you so much for that. Dr. Askew, would you like to share some words from the?
Well, I know that there's so much great information to be heard today, so I'm going to be very, very brief. But I would be remiss if I didn't thank Dr. Peart for all the work she has done in pulling together these panels, the previous panel, and now this most esteemed panel that we pulled together today. I'm really excited about this. You know, I often say that the moral compass of a community is defined by how it treats its youngest and its oldest residents. And that's why I think it's so important to support our children and the families that guide and nurture them. We've gone as far as to resolve and declare that we are a child-friendly county, making intentional and investments in our children's future, especially in times of stress and crisis. And under the leadership of the county executive, we will continue to do that. And my goal is to continue to support and move forward the county executive's vision for supporting our children and our youngest children especially. So thank you all for joining us today. And thank you for your patience and hard work during this most unusual and hopefully never seen again period in our lifetimes. So Dr. Peart, back to you.
Thank you, Dr. Askew. So thanks again and welcome everybody. I am going to be moderating our conversation as well as checking in and seeing who I need to admit into the room. So you'll see me back and forth. So thank you all for your patience, and I'm looking forward to today's discussion. We have 5 organizations, 5 federally qualified health centers in our community of Prince George's County, and they're all represented here today. And I would like us to go ahead and start off. Each center has a mini presentation for us to be informed by. And so I just had a random order, and we would like to have Dr. Carter King start us off for Mary Center. Dr. Carter King, as you're doing your introduction, to yourself, I'm going to go ahead and pull up your slides as well. Is that okay?
Okay. Yes, that's fine. Thank you. Good morning, everyone. I am truly excited and pleased to be here to represent Mary Center. I am a clinical social worker. I am not a doctor. I am a senior clinical social worker at Mary Center, and hopefully you get some more information about what we are able to offer. And please feel free to utilize our services, and don't hesitate to call if there are any questions. I'm ready.
Righty. Seeing my screen?
Not yet.
This is where the patience for technical difficulties comes in.
There we are.
Right.
So Mary Center is located in Washington, D.C. and also in Maryland. We have in PG County, the Adelphi office, which is located at on Riggs Road, 8905 Riggs Road in Adelphi. Thank you. And I'm representing the Behavioral Health Department. Mary Center's mission is to embrace all communities and provide high quality healthcare, education, and social services to build better futures. Our outpatient clinic in Maryland provides services for individuals, families, couples, psychotherapy to children, teenagers, and adults. We also have on-site psychiatrists. We also provide integrated behavioral health as well as parent-child interaction therapy. I will explain both of those in a later slide. But in 2019, the Behavioral Health Department worked with 4,076 participants in 50,404 visits. These are in Maryland. Next slide. The psychotherapy is offered weekly. Previously, we, of course, provided services in person. However, all of our services now are teletherapy. We have 12 clinicians, and 10 of our clinicians are bilingual in Spanish. We serve those who are uninsured, those who have Medicaid, Medicare, and there are services that are provided through some of our counties, the Montgomery Cares, Care for Kids, and we also accept private insurance. Some of the common diagnoses include anxiety, depression, trauma, adjustment disorder, ADHD, personality disorders, schizophrenia, among others. Next. Our psychiatrist is there, as I said, part-time, but she is also bilingual in Spanish. She treats children, teens, and adults. She offers assessments, prescribes medication, and manages medication. And so usually you are able to see a clinician in preparation to see the psychiatrist. As I mentioned before, we have the Integrated Behavioral Health Program. The goal is to integrate mental health and behavioral health services into the primary care setting. The aim is to improve and promote overall health for participants that have unmet behavioral health needs or whose mental health symptoms may be exacerbated, complicated, or manifested as somatic symptoms. The IBH offers 6 individual sessions, and those can be extended for long-term in our outpatient clinic if further services are needed. The referral process is very easy. Once you're seen by the primary care doctor, the doctor will inform the clinician that there's a need for services, and we are able to do what we call a warm handoff. That just means that the doctor lets the clinician know, and the clinician picks it up from there. The parent-child interaction therapy treats children between the ages of 2 and 7 years old who are having disruptive behavior problems. The clinician works with the parents and the child to improve their relationship and also to reduce the unsafe behaviors. During a session, the clinician will observe the interactions between the parent and the child, as well as provide in-the-moment coaching to help parents manage the child's behavior. And they also give them homework that they can work with at home. The PCIT helps establish warmth in the relationship between the parents and the child through learning, applying skills. These are proven and a database to help children feel calm, secure, and good about themselves, which we want for all of our children. Next. So as a result, Mary Center is here to take care of you. We want you to know that it is normal to feel sad, stressed, scared, angry during these times that we're experiencing. You don't have to go through this alone. Our therapists are available to talk to you by phone or video. Our sessions are available in English, Spanish, to children, teens, and adults. And we are accepting new participants in the Maryland offices only. The next slide will show you that we also provide medical telemedicine, as well as teledental. The number for the Mary Center Behavior Health to make appointments is listed 202-851-3240. Also, our website is there where you can get more information, and you would go to our behavioral health section, and there you will find information for children and teens, for adults and seniors, as well as other specialties and services that we provide. There is a wide range of services that we provide based on the needs. So we welcome your questions, welcome your inquiries. Hopefully there's opportunities that we can be better of service to those in PG County, as well as the rest of Maryland. So at this point, we can hit the last slide, which also has our phone number, our website. You can see our logo, and feel free to reach out, and I'm happy to answer any questions at the time, whenever that time comes. So I appreciate your listening. Hopefully we can be of service.
Thank you kindly. All right, next up, we will have a presentation from our colleagues at Greater Baden. Dr. Mukhtar, would you like to go ahead and introduce yourself for us as I set you up to share your screen?
Absolutely. It is nice to meet you all. Thank you all for being here. I think this is an incredibly important topic. And it's nice, coming from Virginia, I actually just moved into the area and I'm just starting here at Greater Baden Medical Center. And this is one of the first opportunities I've had to connect with the community, and what a topic to come into. So I appreciate you guys setting it up, and it's very impressive that we were able to get all these FQHCs on board in a timely manner to really address an important topic. So here at Greater Baden Medical Center, we pull up am I set up to share? Okay, excellent. Let me just make sure we have that.
You should see a permission saying for you to accept.
Do not see that permission. Does it come through the Zoom? I see this. Okay. Can you try that again? It says host disabled attendee screen sharing for me. Oh, now it says you are the co-host. So let's see if that works. Here we go. Oh, I think it has to do with the recording aspect. Until I quit the screen, it won't let me share because it's
Okay. Well, hold on one second. Let me see if I can pull up because what's going to happen is that you'll then see my emails, which may not be the safest thing right now.
Do you want me to loop around and have someone else go while I send you another file for the?
Sure, that would be wonderful. Alexis, is it okay for us to turn over to you?
Yeah, no problem.
All right, thank you.
And
Do you-
so, oh, yeah,
Is there anything for us to share, or are you just going to have a discussion with us to walk you through?
I could pull up the slides that I had.
Oh, no worries. Let me do it for you. But go ahead and do your intro because I have those.
Perfect. So my name is Alexis Kelly. I'm a licensed independent clinical social worker at Family and Medical Counseling Service. I've been with FMCS since about March. When I moved from California to DC, I had 2 weeks to explore the city before things changed. So this is definitely a perfect time to have these discussions about what services are out in the community, so that way I'm also informed in order to better, serve the clients. And so without further ado, I'm really looking forward to just sharing a little bit more about what FMCS services offer. And I'm definitely looking forward to any questions that y'all may have in terms of being better able to serve the clientele, students, etc. Okay, so just for preliminary, our main office is located in Southeast DC, right next to the big chair. All the clients right in session, oh, I'm at the big chair with the therapist. And so that's where we are located. Our telephone number is right there listed, but just so that we all know, 202-889-7900. We're open Monday through Friday, 8:30 to 5:30, as well as Saturday from 9 to 2 to offer our medical services. So it includes both the behavioral health side, primary care, intensive outpatient, which we'll go over in the next slide, but our main office is the Southeast office, but we do also have a location in Maryland, in Seat Pleasant, Maryland. And so there it's Monday, Wednesday, Friday, in-person services being offered, still the same telephone number, 202-889-7900. Our hours are 9 to 5, with Tuesday and Thursday being telemedicine appointments. So we could go to the next slide. And so what do we offer? We have primary medical care, the pediatrics and adolescent medicine, as well as our behavioral health, which includes the individual, family, and group therapy. In addition, because FMCS really wants to offer robust services to the community, we try to have as much as we can in-house, all at one site, so folks are not having to travel to different providers for services. So that's why hopefully we'll be able to best meet your need. So we have hepatitis, HIV, and STD prevention and treatment services, medical case management, especially for our HIV population, outreach services. We go in the community, and they're still going out in the community, for example, for our syringe needle exchange program. That's still going on even during COVID. So we're really appreciative for our staff members who are out there on the ground, still trying to meet the need of the community. Recovery support services, substance abuse counseling, intensive outpatient substance abuse counseling, as well as a medication-assisted treatment, commonly known Suboxone, for example, for opioid addiction. And just so that folks are aware, we do offer free COVID testing. And I believe the turnaround is within 24 to 48 hours. And that's both at the DC and Maryland office. For DC, Tuesday and Thursday from 10 to 1, Maryland, Friday from 10 to 1. Okay, so as we go on, if there's still any questions, please don't hesitate to reach out to Family Medical, 202-889-7900, and our website, which I forgot to list, fmcsinc.org. Thank you.
Thank you. I had a question if panelists will be able to provide their information at the end. I believe that would be okay for me to collate those things, and I can send them out to folks. If you want to give me your email address in the chat box, email address to me messaged privately, I will follow up with you after our presentation to give you that information. All right, let me go ahead and pull up Dr. Mukhtar's presentation so we can get back to Greater Baden. Let's see if I can get that going. All right, this is giving me a little bit of a glitch. Here we go. Save. This is the joy of things in real life, in the moment. me see if I can get this up. Here we go. Then I'll share my screen. Okay. Oh, Doctor, it's not letting me open the format you sent it to me in. All right, I'll wait to get another format from you and then we'll come back. Thank you. All right, so we've had Mary Center, FMCS. Ms. Robin, Ms. Fair, is it all right if we go over to CCI?
Yes, please.
Let me pull you up.
All right. Well, hi, everybody. We are also having technical difficulties on this side, but I'm really happy to be here. I'm Robin Sparrow. I am the Director of Behavioral Health for CCI Health and Wellness. We have locations in Montgomery and Prince George's County. Our locations in Prince George's County are our Greenway Center, Greenbelt, and Tacoma Park. This is a presentation that I did for our board, so I might have to, I'll see when we pass. But we are integrated with our behavioral health and with all of our primary care, and that's actually how our patients access our behavioral health services. They have to be established in primary care. The exception to that would be through our WIC programs or through our refugee health. Those patients can come directly through behavioral health services. They do not have to be established through primary care, although we would like for them to be our patients because we just think it's a better way to work with folks holistically. But those are the 4 sites that we have behavioral health at. We are also doing a 90-day trial over at our Greenbelt Pregnancy Center. We feel that there is a lot of services to be accessed there. So we are having one of our staffs, one of my Greenway staff is going there every Thursday to see what type of services we can help with our new moms. Next slide. That's my staff. We are very multilingual. I am happy to say that, and very diverse. And we have a very good array of languages and expertise. And I'm very pleased that we are finally fully staffed, which is very hard. Next slide, please. So this is the referral process. You can, patients can either come in to a primary care session and ask for behavioral health, or it can happen through a screening process, which is through the PHQ-9, which is depression screening, our GAD, our assessments for anxiety, refugee health. There is a behavioral health screening tool that we use, or just some symptoms they might be presenting. The primary care provider may ask them if they're interested in seeing a behavioral health provider, and that would activate a warm handoff, either in person, or we are now, through the beauty of telehealth and technology, we are able to do a virtual warm handoff through our devices from site to site if staff aren't available. Next slide. I wanted to show a little bit of COVID and behavioral health. These are the type of services we are able to offer. Telehealth has been, I think, a game changer for probably all of us here that are presenting on the panel. And I'll show you some statistics, but telehealth video has been really good, and it's staying very strong. Telephonic, which are our telephone sessions, we really try to limit those to 30 minutes and not for anybody that has acute symptoms. And we have always done in-person visits. We have never stopped seeing patients. We have never shut our doors. And as everybody can probably say, the patient drives the type of visits that they have. We are person-centered. Next slide. So these are the statistics that we just ran in from March to August. That's our COVID data that you can see half of our appointments have been telehealth. So that's how important telehealth has been. 732 have been in person, 356 is telephonic. The same day appointments, I think this is really important. Those are the folks that had come to us via warm handoff, and we were able to convert those into actual appointments. So folks that wanted to stay, and we were able to actually have a full session with them. And that meant that they came in for a primary care appointment, and they had either been screened or something triggered them wanting to see a behavioral health professional, or the primary care provider suggested that they saw. So I thought that was pretty significant data. And then looking forward is that we want to, everybody is in need of more psychiatrists. I can't say that enough. And then we are, as everybody in true behavioral health and integration, psychiatry is at Optum. We are so scheduled out. They really should be used for consultation and managing the more acuity of symptoms, and transferring the management of medication back down to primary care, and so we can actually see more patients. And that's what we are going to try to do. And then the 90-day trial at our Greenbelt Pregnancy Center. So thank you so much. And I look forward to listening to everybody else and getting to some more questions.
Thank you. I think, is my boss still on here? Yes, he is. Dr. Askey, I think I need an award for Zoom juggling.
I agree,
so
she
I
does.
just want him to know this. I'm saying it's recorded so we can go back. Oh my goodness. All right, let me go ahead. Dr. Segura, could I get you to go next for us as I pull up Dr. Mukhtar's piece afterwards?
Sure, definitely.
Great. Please give us.
Well, first of all, Jose Segura. I work for La Clínica del Pueblo. I have been working with La Clínica for the last 6 years. And I have been working in other areas in the Washington, D.C. area. So I know different jurisdictions in the D.C. area. And I'm very happy to be here sharing information with all of you. I'm also a clinical social worker. I'm not a doctor. Just to make sure that we are on the same page on that.
Yes, thank you for the clarification on that too, because I got some information.
And again, La Clínica del Pueblo has more than 35 years providing services in Washington, D.C. That's where our initial and our biggest location is located, right in the Columbia Heights neighborhood of Washington, D.C. And obviously we have been providing a lot of services to the Latino population, and that's in big part our target population. And also a few years ago, probably like 3 years or 4 years ago, we opened our services in Hyattsville, our clinic in Hyattsville, right across the street from the metro station, the Prince George's Plaza metro station. And we have been trying to duplicate the same services that we provide in DC, to do it also in our location in Hyattsville. And I'm very happy to say that we are providing right now medical services, primary care services, integrated, like many of us, many of other federal qualified health centers, they are doing it already, integrated with behavioral health services, because we know that it is a wonderful strategy or intervention to be able to work in a very coordinated way with primary care and behavioral health services. We also provide mental health services. I always call it the traditional one, which is the 45 to an hour session for those individuals who really need that level of care. But we also need, and that's one of the other reasons we have behavioral health services, we also need that sometimes patients don't need the traditional mental health services, and they just need short interventions, and they are ready to go. We also provide community health services, which is a range of different services that has to do with education, with health education. We have groups for people who suffer from diabetes. We have services that target the LGBT population as well in Prince George's County. We do testing for HIV, and we provide case management services and medical services, as well as behavioral health services for people who suffer from HIV. And then obviously we also have the language access, which has been a key item in the La Clínica's history in terms of making sure that patients have access to services in their own language, either when they come to us or when they are referred to somebody else. We go with them to hospitals, we go with them to medical appointments for specialty care. And so we always have someone that can do the translation. And also wanted just to mention very quickly that, we are right now on a modified operation schedule, which means that since COVID-19, the appointments are not as available as they used to be. We have never closed, but there has been a reduction in the available appointments, especially for primary care. The mental health services and the behavioral health unit has never closed, and actually we have seen a reduction in the no-shows, which is something that is very interesting, and we are really looking to see why is the people, especially during the first period of time of the epidemic, they were really looking for that connection. And so obviously, like I think Robin was talking before, I think we are going to see a lot of new options with telemental health that we were not having before. We also provide, in 2015, we opened a school mental health program in Northwestern High School. We have been there providing mental health services, case management services, and just regular support, again, for those individuals, for those schools, for those students who don't really need mental health services, but they just need the extra support in the form of groups or summer activities and just events of that nature. Something interesting to talk about the mental health services and the telemental health services for La Clínica is that we jumped into telemental health in 2015, way back before COVID-19. And one of the reasons that we jumped with a grant from Care First was that finding, and again, Robin mentioned that, finding a psychiatrist who is bilingual in the Washington, D.C. Metropolitan area, it is very difficult. I always mention that it's easier to win the lottery than to find a bilingual Spanish, English-speaking psychiatrist. So it was very interesting that since 2015, we were already providing telemental health services and telepsychiatric services. And in some ways that helped us to be prepared for what happened in 2020 with COVID-19, which was to move all the operations, especially the mental health and the behavioral health services, totally on telemental health. We are not providing right now face-to-face. We are just working on putting together the workflows to be able to see those clients that basically they just cannot handle telemental health. We have to remember that we work with a population with severe limitations, sometimes in the form of technology. And you can see in this slide the different locations that we have, the Highsville Clinic, the contact information for the school-based program in Northwestern High School, that program is only for students that go to Northwestern. But we have been, again, during the whole COVID-19 epidemic, we have been continuing providing support in the form of groups, mental health, and case management services to students in Northwestern High School. And then we have a location in Langley Park. The name is Empoderate, which is, the translation is empower yourself. And that's a location like a drop-in center for LGBT population in the Prince George's County area. So those are some of the information, contact information. And again, I'm very happy to be here and thank you for your attention. Those are some pictures of some of the work that we have been doing in Northwestern High School for the last 5 years. Thank you.
All right, thank you, Jose. And let me exit out of this, and then we can rock and roll over to Greater Baden. Dr. Mukhtar, you're probably like, finally.
Third time the charm.
Let me get your slideshow going.
And while she's pulling that up, so I have been with Greater Baden all of 2 weeks now. And so absolutely excited, but I wanted to give you guys a perspective from someone who's actually worked with Greater Baden as well. So we do have Dr. Sheila Mose here, who's a pediatrician by training with a behavioral health background. She's been with Greater Baden for a while, actually went away and now is back. So we're excited to have her back as well. She's on the call as well, and she's going to chime in at the end of my short presentation. I know we have a question and answer period, so I'll try to keep it short and sweet for you guys. So Greater Baden, established in 1972, and eventually became a federally qualified health center back in 1981. We can go on to the next slide, but really the emphasis and target population for GBMS was the rural communities, the underserved communities. Greater Baden's mission as a nonprofit is really to dedicate themselves to high quality care, accessible primary and preventative care within our community. We can go on to the next slide. So we service large part of the Maryland region. You can go on to the next slide, actually, with 6 different locations. And this next slide will list them for you. We have our main site at Brandywine. We've got a couple sites at Capitol Heights, right next to each other, Capitol Heights 2, La Plata, Leonardtown, and Oxon Hill, which mostly services pediatric. We'll go on to the next slide. The behavioral health wing really is able to service a majority of these sites, and now with COVID moving to a lot of remote work, just as a lot of the other clinics have done. So we've got our behavioral health team that includes therapists, psychiatrists, practitioners who do medication management, and with the new management and leadership that we have on, they've really put an emphasis in trying to grow and establish our mental health foot here in the Maryland community, and really integrated approach, patient-centered approach, really trying to find out what it is our patients need, because every target population is different, and trying to put forth those resources for them. So before I speak a little bit more about the mental health wing, I just want to let you guys know that we offer a variety of services across our locations, to include adult primary care, women's services, pediatric services. We have a WIC service on board, and we're really closely with the Ryan White program, HIV and AIDS counseling as well. And Dr. Haley is heading that, and she recently came on, and they're doing an excellent job over there. So from a mental behavioral health standpoint, we're really trying to connect with some of these other departments to make sure that we're not just covering behavioral health concerns, but we're looking at mind, body, and spirit resources, and basically what it is that they need to be happy, healthy, and be able to succeed. If we can move on to the next slide. Next slide, please. Next slide. Sorry, I had this kind of adjusted to what I wanted to show, but we've had some technical difficulties, so I had to go back to the original. One more slide, I think, and where we need to be. Excellent. So within our behavioral health wing, again, we really focus on individual, family, and group therapy, case management, medication management. Dr. Vereen runs our substance abuse assessment and treatment wing, and we really will be working closely with Dr. Vereen because a lot of those patients overlapping services with mental health. And just like all of the other clinics mentioned, we do psychiatric evaluation, diagnostics, and treatment, both in short-term and long-term care with patients. And so what we're trying to do is get our name out there and let people know that whatever service you need, reach out to Greater Baden. We will bring you for an evaluation, and based off of that evaluation, just like my colleagues here have mentioned, we do various screenings. If it's triggered, that screenings tells us, hey, this person might need access to social care, or this person might need some therapy, or might need medication management. We're able to really try to do that for the families. I think one more slide, and we're done with this part of the presentation. We service people 6 and up. We accept all insurances, including Medicaid and Medicare. And regardless of whether a person's ability to pay, we will see that patient as well. We serve a large catchment area. And again, with remote and tele services, we're able to really extend that treatment that sometimes have a hard time getting back and forth. So we're excited to be here. We're growing rapidly, and we want to hear from you guys what it is that we can do to make things easier on you. Let me step back now. I know I've talked it out and let Dr. Mose chime in.
Hello, this is Dr. Mose. As Dr. Mukhtar indicated, I'm a pediatrician, but I have subspecialty training in behavior and developmental pediatrics. I too have been back at Greater Baden for approximately 2 weeks. However, I was here for a stint a few years ago, and I've been practicing in Prince George's County the whole time. I think what I personally work at Capitol Heights 2, which is part of the Greater Baden complex. And at my center, we do behavioral health, and we also do women's health and pediatrics. As a behavioral pediatrician, one of the things that my practice is pretty heavily integrated. And we deal with parental concerns, we deal with parental support, children who have learning differences, we deal with attention deficit hyperactivity, as well as autism spectrum, people with the autism on the autism spectrum, as well as children who have developmental disabilities. With that being said, we also have the ease here at our center of transferring off folks who need more intensive training or more intensive treatment, or who need medications. I think it's very important that we take the perspective of the children as we're doing with all this. And I'm delighted to hear that Prince George's County from the top has been promoting children and promoting children's health. And I think it's important to include the children because they are definitely the ones who are going to be executing these things in the years to come after this COVID has passed, if you will. So I think it's important to listen to the children and incorporate their needs into whatever decision-making is going on with communities. And I think we at Greater Baden definitely promote children and promote women's health and as well as mental health. So thank you.
Thank you, Dr. Mose.
All right, well, thank you all for the presentations. Again, you can message me privately in the chat to give me your email so that I can follow up with you for any of the information that you would like for our presenters and their organizations. So this now takes us into our question answer discussion portion. I know some of you may have questions in the chat, but while I search that, one of the kickoff questions I would like to ask our panelists, because I'm hearing a few things that I was jotting down through this. You're all in various locations across the county. And in our prep sessions, a lot of the things that you were recognizing as trends in terms of how parents or guardians are accessing services are pretty much similar across the board. My question with that is, given the trends that you're observing, what are some of the things that you think you will sustain in your adjusted programming formats?
This is Robin with CCI. I think telehealth is definitely here to stay. I think that I don't know what the payer sources, being the insurance carriers, are going to do once the state of emergencies have been listed fully, because right now they are giving us a lot of leniency for that. So we always have to take that in consideration about what the reimbursable is going to be. So I think we have to take that in consideration. So we definitely need to start prepping. I think our families that they may have to start getting their services back on site. I think that's going to be the challenge for us, for those folks. But I think telehealth has proven that it is very an effective form of behavioral health. Not so much for our experience for very young children. I think probably more for maybe middle to high school, but I'd like to hear from my colleagues what experience they've had for that.
So I'd like to express that I agree that virtual, online, and virtual therapy will be here for a long time, and I anticipate that we will continue to do that. There's discussion already that we hope to continue to do virtual services. Where we hope to grow, one of the areas is with groups and with small children. I think for us, I think it's been more challenging to work with small children who may have some attention issues and some other issues, to do that through telehealth and telebehavior health. So that has been a challenge, but I think as we continue to perfect and improve and get more creative with those approaches, we might be able to expand. But we would like to have more groups with our children, and as well as older adults, older participants. So the telehealth, I think, is definitely here to stay. I think the transition back to the office is quite an adjustment, but I think what happens is our teenagers and school-age children are so used to being in front of the screen that to do it with virtual sometimes is a challenge, and they want the variety. And so we have to continue to be as creative and innovative as possible to continue to get their attention, to continue to provide their services, and to make it more meaningful and adaptable to their needs as well. So we hope to be continuing to grow in those areas.
I would like to chime in and just kind of piggyback on what Robin mentioned. So she's absolutely right. Telehealth has provided a real boost for a lot of families that had transportation issues, that, you know, we've seen no-show rates kind of climb down with people being able to access care more often. Part of it will be dependent on how the payers proceed moving forward, but it's our job as clinicians and people in the mental health field to say, hey, this is how it's helped our patients, you know, be able to provide them that information, really advocate for them to be able to continue some of these services moving forward. So with that being said, I agree that I think it's here to stay. And there are always going to come pros and cons from doing things virtual. You know, part of the real pro that I see it being an asset for is us to be able to do things like this, reach a large population of people, provide that education that, you know, maybe they wouldn't have had readily available to them, and to tell them, hey, this is what mental health is, help tackle some of that stigma. Show them that it's, you know, we're in a global pandemic. So a lot of the classic symptoms of anxiety and depression, a lot of us are feeling, right? Whether you've been clinically diagnosed or not, you know, we've all got some of these patterns of thoughts and feelings going on, just due to the very nature that, you know, our lives have kind of been flipped upside down. You know, parents have become teachers. People who are outdoorsy have become homebodies now, and so it's not what we're used to. So being able to reach out to people in their homes and say, this is what we have, this is what we can do for you, I think will be a real help moving forward as we transition and kind of get used to this new norm.
And again, from the experience that we are having in Clinica, I think that I agree with all of you. Telemental health should stay with us, and hopefully once the emergency rule ends, we will continue to provide services so that Medicaid can, you know, we can bill for Medicaid or the other insurances. We have had a lot of good experiences with groups, especially adults. In our location in DC, we provide substance use services. We are certified by DDH to provide services in DC. And the experience has been very, very positive. Clients has been expressed a lot of positives about receiving the services online. There are some issues that are coming along the way as well that we need to pay attention as providers, like privacy issues, barriers about sharing information in a room with people, especially for specific populations like domestic violence, where you definitely cannot share a lot of information in from home. But so those are some of the things that we have to now kind of like explore, and hopefully very soon research would come along in terms of how effective we are being with providing telemental health services and telepsychiatric services, as well as groups.
And just to echo what my colleagues have said, very similarly, that telehealth, hopefully it's here to stay, and I hope that the evidence continues to speak for itself, so that way these services are reimbursable. But you're absolutely right. Just the nuance of being able to provide services in someone's home amongst family members that are also home as well. And so just being dynamic with the patients as well through this process and normalizing the collective stress. This is sort of an unorthodox process that we're all going through. So how do we make this work together? Is there a way for you? I think I have one client, we meet in her closet. And so that way it's private conversation and not her younger daughter overhearing the adult conversations that we're having. And so I think the level of flexibility I'm willing to have with the patients also is demonstrated in terms of their flexibility, being able to adhere to the policy of privacy and that confidentiality piece that we still want to honor as if we were in session. And I also think too, I learned that I tend to be a little bit more lenient on certain things. People need to smoke a cigarette. Okay, go ahead and smoke a cigarette while we're talking about all these stressful things. I just try to meet them where they're at, because at the end of the day, they showed up. So that demonstrates to me that there's a service that they're looking for. So I'm gonna meet the need and not necessarily get too wrapped up. I mean, we're in the car and the phone is down. Flexibility. I learned with flexibility, and I'm hoping that telehealth continues, because that way we're still able to provide the service and not worry about, are you not here in person in order to get the service? So I'm hoping that this does continue.
Well, I'm glad to hear that. And I'm glad that the conversation about how to help with security comes in, right? Because we are talking about very sensitive topics when we're having our telemed or telehealth conversations. I have my session every Thursday morning. I just need to go back into session because it's too much going on, and I just need a space to vent every morning to kind of get myself sorted out with all the things going on, because you're dealing with, yes, your day-to-day job, but then being at home and dealing with family health issues, your personal health issues, and everything else that comes along is a lot during this time. So the security side of it is important, because we have families in very unique spaces when it comes to access and safety or security. One of the questions that came up relates to domestic violence for children and women. And as providers, have you seen an increase in any of these reports or cases of domestic violence for children or women since the pandemic? Is that something you guys have seen?
I'm not sure if it's so overt. I know statistically, nationally, I've heard that it's on the rise, but I think that what we're seeing is parents come in that are very stressed, and they are focused on the child, and we see children that are perfectly normal, who maybe just get a little cagey, and what we have to do is maybe switch our focus to who actually may be what the presenting issue is, and trying to navigate that there might be some other stressors in the home that may be domestic violence related, and trying to I'm working with one of my staff members right now that's what we suspect, that there's something other stressor in the home. But what presented was the child. And you have to be very careful with that, because we want to make sure that there's a safe space, and it may take a little while for the parent to actually be honest about it. So it is a very tricky and delicate subject, but we know statistically that it is on the rise. But we have to be very careful about it too.
Right. And, that brings up too the query around when we suspect something as providers in this space, how do we encourage parents and guardians to advocate for themselves, right? Because the issue is presenting in the child, even though it's really with the parent or the guardian. And I find it, because I come from a space of child and adolescent psychology, and I'm great to work with them and, do the assessments and see things in them. But then to go back to their parent or guardian and say, well, the issue is really with you. How do we get the parent or the guardian to recognize their own burdens and frustrations and to advocate for themselves?
I think that, but the first thing that comes to my mind is that we have to support parents and guardians about taking care of themselves. To recognize that we all are going through very difficult times, not just only for COVID-19, but for many other things that are happening right now in our society that they are very toxic, unfortunately. And so I think that that's one of the first ways that we can support parents, just help them to acknowledge that it's okay to feel anxious, that it's okay to feel frustrated, but that they need to create moments in their busy schedule to take care of themselves and to recognize that this is bigger than themselves, and that it is okay to ask for help as well. We know that behavioral health services, sometimes there is still a lot of stereotypes about receiving or asking help for mental health services. And so we have to be strong in terms of sending the message that it's just perfectly okay to ask for help in this particular moment.
Right. Thank you. Yeah.
As Dr. Peart, as you were saying that, I immediately thought of the Darwinian theories of family stress and how one stressor is really ever just or the father or the child. It's going to permeate throughout the family unit. It's going to affect everybody. And so part of our job is to do exactly what you were saying, which is educate the parent that yes, the child may be acting out, but it might be because of X, Y, and Z. Also, to piggyback on Robin's comment, she's absolutely right. I don't have, it's not always very overt, but statistically, not only is domestic violence increased during COVID, but self-medication and substance use has increased amongst adolescents, amongst adults. In some ways, it might be people trying to self-medicate while they are at home. By the very nature of people being around each other, who maybe already had an issue with domestic violence, you have more opportunity for exacerbation of these type of issues. And so I believe it when I hear these statistics across the board are going up during this time where people are at home and people are out of jobs and people are stressed financially. And then the imperative becomes on us to really try to enter that home and serve as that outlet for that family that may be in distress. I talked to one of my colleagues who said, it breaks her heart because she used to work as a school nurse, and she knew that, even though she wasn't supposed to, some kids would come in hungry in the morning and she would provide for them. And she knows now that they don't have that check at school because they are studying at home. So how can we try to enter that home and be that check and be able to advocate and educate and set them up with resources when they don't have them? There's some things to keep in mind and some things that we as organizations really should be trying to fill that gap.
Right. I'm glad you raised one of the other trends going on, which is the self-medication, the substance use, not just among adults, but also among our adolescent population. A few weeks ago, I was on a call regarding the status of opioid use and overdose in the county. Not many people know it's here in the county, and it is a serious issue. The combination of opioid use and alcohol has significantly spiked during the pandemic in several pockets of adult communities, but the alcohol and smoking spikes in the adolescent population is also something that's interesting. And how we now think about, as the county executive was saying earlier, kind of the opportunity gap that has been created, and then the health gap that has also been created. So not only are our students going to be struggling academically, but their social well-being is now being hindered because of the pressures that they're dealing with. So what are some of the tidbits that you think as providers, you could, your top 2 or 3 things for parents or guardians probably dealing with substance use issues themselves, children, or parents and guardians who are recognizing substance use among their young person? How do you help navigate? What are some of the tips you could give to navigate those things?
I think I just want to first say, just like we all, can agree that this is a collective stress, it's also equally a collective journey of healing as well. And so this can be the time to really fortify relationships that might have went amiss through the busy schedule. And so this is a time where you can really get the help you may need, parent and or child, now that there is more flexibility in scheduling because we're not doing our normal day to day. So I think it's being proactive and intentional with the time that we have during this pandemic, since we're not on our normal schedule. So what I would definitely offer to parents is to be open as a learner, the same way students are having to be learners with this distance learning platform. I think like the kind of like they mentioned, going back to 10th grade. I mean, I think also too comes with those social challenges. I meet with my young kids, and I notice with them, I have to be more direct in the language. It sounds like to me there's some intimate partner violence going on. What do you think about that? It sounds like there's some peer pressuring, some bullying. It sounds like there's been some abusive behavior, some controlling behaviors. Very direct, because I don't think they're having maybe that dialogue. And so usually the parent is just right there in earshot. So I want the parent to be able to learn that they have to be direct with the students, because it's happening. The smoking is happening, sexual activity is happening, abusive characteristics are being displayed. So being able to normalize the discussion, so that way they too will also learn that they can start having those transparent conversations with their children. So that was definitely one of my tips, because I'm noticing with some of the kids, this is their first time of actually being able to disclose some of the things that they maybe felt ashamed about or felt nervous about with the parent alone. Hopefully that might be one tip.
Yeah, thank you.
So I think it's really important that we cannot underestimate the power of self-care and really putting in different coping strategies for our patients. And I always believe if you're going to take something away, you got to put something back in. So part of it is just helping our patients, whether it's an adult or a youth, manage the current situation, because it's such a unique situation that it's something any of us have ever had to face. So if it's managing the drinking or the substance use and telling them to stop it, how do they manage it? Because if they've disclosed it, we have to accept it and honor it instead of having this strong reaction. So part of that is having healthy habits, and then we like to use a lot of mindfulness and self-care. We use cognitive behavioral therapy at CCI, and we try to talk to them about that, try to replace some of the other coping techniques that they forgot: exercising, getting out, enjoying the fresh air, looking up YouTube videos on yoga and deep breathing, I use an app called the Virtual Hope Box. I'm not sure if people know about that, but it actually talks about, gives you breathing techniques and relaxation music, and has a lot of redirection. And it's a really good app that I used when I got my CBT training. So we always have to be creative of what their strengths are and what they've tapped into and what they have forgot or stopped using, to see if they can incorporate it back. And for smaller children, I'm not sure if you all saw this, but last week, Washington Post did an article on this wonderful woman that does this YouTube show called Cosmic Kids. And it's mindfulness and yoga for young kids. And she was a struggling actress that I guess she said her personality was too big, but she does this with a Teletubby type of flair. And it's gone off like gangbusters. So parents can actually have said that they can plop their kids in front of the TVs and they love it. Young children, elementary school to middle school, are learning how to do yoga and mindfulness because it's colorful and it's engaging, and parents can actually take a time out and do some self-care of their own, or even do it with her while during the day during these virtual classes, because I know that some of the schools are allowing them to do some physical education, but maybe they don't want to go outside. So that's a resource we've been talking to our families about to help their kids.
Okay, nice. Thank you for those tidbits.
So I want to piggyback on that one. As we talk about the integrative approach, I want us to also keep in mind that there's a holistic approach. And by that, I'm talking about nutrition. I'm talking about sleep. I'm talking about exercise. I'm talking about doing things to, as she spoke about, your mindfulness, your meditation, your yoga. All those things are going to be combined to help us learn how to manage during this time of stress, this time of being overwhelmed. And we also need to find ways that we can cope with it, and then techniques, as she's talking about, for calming, for relaxation, and look at the whole person, not just looking at their mental health, but looking at how they're eating, what other habits they're having, positive social interactions and supports, very important. All those things help with relaxation, but it also with resiliency. We want to be able to be resilient during this time. High stress, overwhelm, and not all the uncertainty. And so finding ways that you can build these things into your lifestyle, and it's not overnight, but it's gradual. How do you provide a way for you to be calm each day, not once a week, but each day? How do you get some type of physical exercise? Are the foods and beverages that you're drinking consistent with the lifestyle and the health that you want? Paying attention to all of that. And we can't underestimate our ability to continue to learn, to continue to grow, and keep a positive mindset. Things that you're grateful for every day. I know there's a lot we are not grateful for, but what things are we grateful for? That thought of gratitude, thankfulness, and finding positivity. When is a glass half full? Is a glass half empty? Ways that we can train ourselves, train our minds so that we can be in a better space. And we have to continue to practice it. It's not overnight, but it is a continuum. How do you keep that going? And how do you include them in incremental steps throughout your lifestyle? It is holistic, not just one approach.
Thank you for that. Thank you for that.
I was going to say, I think the panelists have done an excellent job touching on kind of the psychological and the social aspect of mental health and some of the treatments that we use for that. I'd like to dive a little bit more into the biological aspect as well. People with schizophrenia are more likely to smoke cigarettes. People with bipolar depression are more likely to use stimulants. People with the general anxiety disorder are more likely to use alcohol. And why is that? Because sometimes unknowingly, we say self-medication, but they're able to manipulate the neurotransmitters in their head to help treat some of those symptoms that they're feeling. And so our job when we bring them in is to help, one, diagnose what is the root cause of this distress, and then to say, well, we're going to do kind of what you've been doing, but in a much safer way.
Right.
In situations where socially things might be doing, just fine. You might be working, that's not an issue for you. Psychologically, you've never really had much, had a good childhood, good upbringing. You can't really put a finger as to why it is that you're feeling the way you feel. And sometimes there is that biological component that would need medication management. I always encourage patients, if you are in distress, sometimes you don't know why it is you feel the way you do, seek professional care. They're able to kind of take your hand and help explain what it is to you. And then ultimately, it's your decision for how you want to proceed. You will not be forced to any medication. You are an autonomous being, and so you will get to choose exactly what you want to do. Our job is just to inform you.
Right.
And I'm sorry.
No, go ahead.
Another dimension that I think that we all, as providers and people who work with federal qualified health centers that work with people from most of the time from disadvantaged socioeconomic status, we have to remember that if we don't pay attention to the social determinants of health, there is no mind, there is no technique, there is not going to be therapy that is going to really help to move our patients to a different level of care. So that's something that we always have to remember, that the social determinants of health, we can just not forget about them and pretend that everything can be resolved in a 45-minute session or a behavioral health integration intervention.
I'm glad you mentioned that, because as we're coming up on our closing piece, there are two things that I wanted us to make sure that we touch on, because in our prep conversations, we had amazing dialogue too about culture. The social determinants of health are critical across the board, regardless of geographic location, religious background, education, or regardless of culture. And in the county, we have such rich cultural communities, neighborhoods. We're talking about multiple languages, multiple foods, rich in culture. And coming from a different culture where mental health or behavioral health is not something that it's not dinner conversation, right? It's not something that we talk about when we're cooking dinner, or like, how was your day today? How was your behavioral health today? Those are not the dialogues that we have. So one of the things I wanted to ask and throw out there to throw out to the panel is, how do we navigate our service provision, our programming development within the context of equity, given the cultural dynamics that we have? How have you had to navigate that, and how do you foresee that going forward?
So Mary Center originated, as some of the others, as a resource for communities of Latin descent, people who speak Spanish, who are from a different culture, helping them acclimate. So equity first starts being able to speak the language. And so we have a lot of therapists, clinicians, as well as medical and other providers who are able to speak with them in their language. And I have been amazed at how receptive the services that people are coming in for on a regular and consistent basis, because they're seeing their symptoms and they want the relief from those symptoms. So language, of course, and proximity to their neighborhoods, as to the extent that we can, or at least public transportation, accessibility, those types of things will help with equity. And then as we grow and put our words out there, being able to talk to those communities and go to their locations when they're having activities and present what we are able to offer. And we are in the Mary Centers in school-based mental health as well. We are in High Point High School in Prince George's County, going to the high schools, going to their places where they frequent, and presenting and sharing what we are able to offer and what our services are about. And I think once we can meet them where they are, they have been absorbing and receptive to services. But first we have to speak their language, speak the same language. We have to go to their locations. We have to be accessible by public transportation and have accessible parking, of course. And all those things will help increase equity. We have a long way to go to catch up, but I think slowly but surely that word of mouth, and when they are given services and they are given respect and treated humanely, that translates into all languages across all cultures.
Right.
And they will talk, and word of mouth will be out there, and you will see that people are receptive and resourceful to come in and be and take care and be available to afford those services.
Thank you. Yes, I agree.
I think that, go ahead, Doctor.
One particular patient that I worked with in a brief stint that I spent in New York working with an immigration clinic, and he had been referred by his lawyer to come in for a mental health screening as part of his case, and he came in not knowing what he was coming in for, right? They just said, go to the office. By the end of the session and by the end of the treatment, you know, he broke down and said, I've never, in the 13 years I've been in the United States, he was undocumented, never had any type of experience like this where I could share the things that I've been through. Actually ended up becoming a volunteer at the clinic, and his job was to go out and spread the word, essentially, because he said, this has really changed the way I live, and I want other people to know that this thing is just down the street. And he knows a lot of the people in his community had no idea or don't know what they offer. So a big part of what we need to be doing, again, is getting into the community, educating, letting them, doing events like this to let them know this is our resources. And I think it's a great idea where we have this collaborative effort among the FQHCs and the health organizations in the community, because together we're going to be able to push that message and that narrative a lot more effectively than we would.
Yes, thank you. Yeah.
I think that, you know, the language piece, Brenda, thank you for putting that on the table. That is very important to really get to, especially for those groups of immigrants that don't speak English, or English is not the first language. But, you know, language is key to access services. But I think that we also have to invest on bring clinicians and staff that is culturally competent, and that is able to work with people who are coming from very, very different backgrounds than the ones that we have, and that they are in a continuously self-evaluation of how is that I am doing when I work with someone that is coming from a very different background. And I'm not talking about another country, even within the US, you may be coming from very different backgrounds.
Correct.
So I think that that is also very important to make our places welcoming, so that they know that they are well received. And then the other piece that I just wanted to mention is that we need to invest a lot of trauma-informed care and make sure that all our organizations are trained, you know, so that the moment that the patient opens the door, they know that they are going to be welcoming in a very nice way, acknowledging that anyone that comes into our places, they may have a long history of trauma, and everyone in the organization has to know that.
Yes.
I 100% agree, Jose, and we were just talking about that at the senior leadership level. So trauma-informed care means in a full integrated model, not just with behavioral health, because a lot of our customers that come in, patients that are coming in for primary care, can be traumatized from a simple physical examination. The level of trauma, and we talked about this in our in our planning meeting, you know, especially with CCI that are getting refugees, asylees, and folks that have gone, you know, who have been tortured, have had horrific journeys. They're incredibly resilient. The stories that we've heard, you know, they don't know the difference between a therapist and a doctor. They think we all are doctors. So we have to even explain what we do. And so they're terrified of hospitals. They're terrified of doctors and nurses, and it's really an educational journey for them to really understand that there's somebody here that's interested in, want to help them and to process what they've been through, because it's a very overwhelming experience to come to a new country and try to establish yourself, not to mention to explain the journey, the horrific traumatized journey that you went through that you never thought that you would ever experience in your life. And then you also have family members that you're worried about back in your home country. So, and being culturally competent is important, but we also have to be also attuned and have interpreting services for all the languages that we're going to be exposed to. So we at CCI, we use tablets, and we have interpreting services because we have so many languages, and every day I am really surprised by the micro languages that we have to tap into. Some of the folks that we have to we are serving. So it's fantastic, and I learn from our patients more than sometimes they learn from me. And just to be open to learning about cultures and what they're experiencing. So it's a journey for all of us.
Yes, yes.
I'd just like to add briefly, echoing all that's been said, and especially punctuating the equity amongst the staff being trained and regularly trained. And the language doesn't have to always be linguistic.
Right.
FMCS is predominantly an African-American community, so having the language of the Southeast native. I'm not from Southeast, I'm from California, but still being able to integrate myself with them along their journey of saying, I want to move because I'm tired of the gunshot. I have a 7-year-old saying he's afraid to go outside because of gunshots. And so really being able to be at a place of recognizing that the stress is high, and by you coming here communicating this, and that I understand that while we might not be able to change the outcome today or tomorrow, at least you know you're not alone in the collective experience that you may be having. And so having staff being empathetic to that would be really quite important, as well as we mentioned, LGBT communities, deaf and hard of hearing. I mean, the list can go on and on about the cultural competency and being trauma informed. Lastly, with FMCS, we have a lot of our cases coming from U.S. District Court. So being legally involved can be traumatizing, especially at a time like this. So being able to really work one-on-one with clients on talking about, I get it, marijuana doesn't seem like a big deal, but that can get you incarcerated. So how do we work together with the system that you're in right now and recognize that this doesn't have to be a forever, but you want to make sure you'll be free. So really being in the here and now with the patients, because I think oftentimes, especially for the Black community, it's sort of like me against the world, but recognize that there are folks all around that want to support their livelihood, support their growth, and that they don't have to fight with both fists up everywhere. That there's a place where they can put the fist down and release. So hopefully that's something that's done with service providers in their ability to meet their needs, culturally competent, trauma-informed, holistic, medically, and just being able to meet the human with another human.
I can't even. Yes. It's amazing. It's amazing. You guys touched on all those things that kind of swirl in my head every day when it comes to how we can make sure, as a human services umbrella, how we make sure that we're being equitable, effective, efficient, all these E's, on a daily basis in the work that we're doing. And it's so good to hear that we at the county executive level too can learn from you. You know, this is why I was saying again in our prep conversations that it is an honor for me to host all 5 FQHCs at once. Like, this is phenomenal to me. And to hear the power of the work that is going on and still going on and elevated in some circumstances on a daily basis for our citizens is amazing. So there's a lot more that we should be talking about, and a lot more that I know our residents and citizens would like to learn from you about. And so this has been wonderful. And I only promise to take up just an hour and a half maximum of your time, but we've gone over. So I do not want to take up any more of your time, but I will be sharing, some folks had emailed me or sent me their emails, so I'll be sharing information with them. Is it okay to share the PowerPoints that were shared today with those folks? Okay, great. And they'll be reaching out to you with other questions that they have also. So this was amazing, and I really am grateful for everybody's time. And I want to make a plug and say that you've challenged me to think about how to keep this moving, this type of energy and momentum around this topic, and to see if we can develop specialized webinars to just like focus on behavioral health in immigrant communities as a session down the road, behavioral health specific to special needs populations and what that may look like, because it varies because of the nuances of these communities, and we want to respect those nuances because they make us stronger as a community. So I'm very, very grateful for everyone's time, everyone's passion and commitment to this work, and for keeping us informed and on the ball as we're moving forward. So with that, any last remarks or information plugs that you'd like to share with our community before we close out?
I would encourage everyone to go on all of the various websites, check out which clinics are close to your area, what resources they offer, and feel free absolutely to call and inquire, even if there's no notification. There's no commitment. Sometimes calling just for information, having that be a part of your active or safety plan would be beneficial.
Yes, thank you. Yes.
Yeah, I just want to say, get your flu shot. So now's the time, because a lot of us are also health centers, and we are open for new patients for health as well as behavioral health. And if you do not have a medical home, as we've all said, go look on the website, see what's close to your home, bring your family, you and your family come in, go get established as us being your medical home, so you can get your behavioral health needs, a lot of other needs met, but please get your flu shot, because that's the other thing that's going to affect our community. And don't wait for that, because we have them and are ready. We're ready to give it to you.
I just want to say thank you so much for this opportunity. This has been a wonderful space for us to talk about these really important issues. And we know that mental health extends across all lines and parts of our health. So we appreciate the opportunity to be present, to engage, and to provide services from Mary Center. Look us up and let us know how we can be of service. Thank you.
Thank you. All right, the last thing I'll say is if anyone has any other questions, they can email mentalhealth@co.pg.md.us. So they can email the county executive's office again at mentalhealth@co.pg.md.us.
Okay.
So I want to make that plug as well. And thank you all again for having this conversation with me. Please go and eat lunch and have a great rest of your day.
Thank you.
Thank you.
Bye.
Thank you.
Thank you.
Thank you.